Hey, what's up, everybody? Welcome back to my channel. My name is Tamisha, the Codepreneur, as well as your spiritual growth coach here on YouTube, keeping it raw, real, and relatable. All right, so in this video, I want to talk about some unforeseen challenges you may come across while you are on field work. I'm going to take a snippet out of my new book, Classroom to Clinic, all right? And we're going to look at one of the scenarios of a potential unforeseen problem that you probably come across. It might happen to you, it might not happen to you, but I just want to give you guys an idea of real life scenarios that you may encounter. So I'm gonna pull up a scenario directly from my book. And this is case one, and I'm gonna read it to you guys. So case one says, Sarah is an occupational therapy student who is currently completing her fieldwork in a skilled nursing facility. One day, she arrives at her assigned unit to find out that her fieldwork educator has called out sick, and there is no one available to supervise her for the day. She's not sure what to do and feels overwhelmed by the situation. So how many of you guys can relate to this? Because I think it actually happened to me. Now I think about it. I think that happened to me before when I was on field work. Now don't quote me on this. It was like 11 years ago, but I'm pretty sure I had an experience where a supervisor had called out and I was there by myself. So what I do in my book here is you're going to have that scenario and then you're going to have steps to deal with the problem. So for this particular scenario, I'm going to tell you guys what it is, right? I'm giving you a little snippet out of my book here, my new book. And these are the 7 steps on how to deal with the problem. So the first thing is you want to stay calm, right? Take a deep breath. It is important not to panic or become overly anxious about the situation. That is step 1. Take a breather. Okay? It will be all right. Things will not fall apart. Okay? That's tip number 1. Tip number 2 is contact your fieldwork coordinator, all right, or other faculty members at the school to inform them of the situation and to ask for guidance on how to proceed. Now, keep in mind there's no order to these tips and steps that I'm giving you. There's no order. I'm just telling you and giving you advice on what you can do in this particular scenario. If you find yourself at a fieldwork site, let's say, for example, there's only one OT and you're the OTA, you're the student, and there's no other OTs there for you to, um, follow, shadow, whatever, to supervise you, or maybe there's no OTs feel comfortable in supervising you. The next thing you want to do is call your fieldwork coordinator at your school. And usually whenever you're out in fieldwork, they're usually very accessible to you because they know that students are out in fieldwork. And you can ask them, okay, this is the situation. How do I proceed? You can even talk to maybe one of the faculty there on staff, primarily the director of the rehab, to see what they would like for you to do. Tip number 3 is you want to communicate with the staff on the unit to explain the situation and ask if there are any other occupational therapists or therapists from other disciplines available to assist you for the day. That is perfectly fine. Sometimes you may just need to shadow PT, or you may need to just shadow speech. And that is also a really good learning opportunity because then you can see how the other disciplines work. Okay? Tip number 4, if no one is available, consider using the time to observe other therapy sessions, read up on the facility's policies and procedures, or review documentation from previous sessions. So you don't want to just sit around and do anything. No, I'm sorry. You don't want to sit around and do nothing, right? You will still want to utilize your time there. It's still your time, right? So use that to observe the facility, think of intervention ideas, go over documentation, open up your book, review cases, review diagnosis, maybe look at chart reviews, go through documentation. There's so many things you can still do even if your supervisor is not in the building. All right. Tip number 5. Tip number 5 is take the opportunity to practice self-reflection and identify areas for personal and professional growth while and during your fieldwork. So I mention this because I think it's very important that while you're on site, you think about how you've been performing. This is a good time to do that while you don't have the busyness of following your supervisor, or maybe you're not at that stage. Maybe you're more advanced now that you're treating patients, you know, carrying a caseload, doing documentation, going to your supervisor's meetings, or maybe, just all the busyness that you would normally do in the day. This is a good time to kind of just self-reflect. If you're not going to be with your supervisor, if they're not requiring you to still see patients without your supervisor, it's a good time to reflect. Now, I do not see a facility making you see patients if your supervisor is not around. Okay? That should not be. If that happens and you are uncomfortable with that situation, reach out to your fieldwork coordinator at your school, okay, and seek advice. All right, tip number 6. Document the situation and any actions taken to address it in your fieldwork log or other required documentation. So you can mention, my supervisor was out today. This is what I'm going to be doing. So you write it down, you document it, right? And then when your supervisor comes in the next day, you can say, okay, this is what I learned, this is what I observed, these are the questions I have, right? And then last thing, tip number 7 is follow up with your fieldwork educator as soon as possible to discuss the situation, any concerns or questions that may have arise during the day. So this kind of overlap a little bit on tip number 6, but again, you're communicating, you're having conversation, and the most important thing is to remember it's important to stay flexible and adaptable during field work, as unexpected situations will occur. All right. And guys, I literally just read to you from my new book. So if you are enjoying just that one little case scenario and you're like, wow, that was really cool, Tamisha, give me more, you need to get your hands on my new book. All right. Classroom to Clinic, Surviving and Thriving on Fieldwork. This is your resource and reference guide. This is literally the only book you will need going out, other than your school books that you're going to keep at home. Obviously, you can't bring everything with you, but this is literally the only book that I advise for you to walk with when you go on fieldwork, because it has the weekly reflection. I know it's kind of hard to see, but you have the weekly reflection there, where you can write all these kind of situation, take notes, whatever you need to do, you can put in this book. This book is meant for you to write in it, all right, and use it. Don't just read it and then put it aside, actually use it. So guys, I hope that you enjoyed this video. If you want more, definitely be sure to leave a comment in the description below. If you want to get your hands on my new book, you can go to my website, www.tamishatross.com, or you can find it on Amazon, or simply click the link down in the description to get your hands on this new book. Well, I hope you enjoy it. If you are wondering how I am as an author, I would definitely advise you to check out all the other books I have written. You guys are already probably familiar with this book, 12 Case Studies. If you are going into, let's say, a skilled nursing facility as a student, I'd advise you to definitely get your hand on the fieldwork book, and definitely get your hand on the 12 Case Studies book, which is meant for skilled nursing facilities. You are going to be in a good situation if you have both of these going into that. All right, guys, until next time, take care. Bye-bye.